Also from FCBarcelona, we now have Carlos Pedret, who's going to speak on ultrasound imaging of tendons.
Hello and welcome to the Barça Sports Medicine Conference. This year, as you can see, we're talking about managing tendinopathy and tendon injuries, and I want to speak a little bit about how can imaging help in managing tendinopathies, especially my field, which is the ultrasound. So let's start. What do we know until now, according to tendinopathies and imaging changes and especially ultrasound? We know that cellular structural changes seem to be the main reason of the development of the pain and or the pathology in the tendinopathy. Yeah, we know that. Asymptomatic tendons with structural changes in ultrasound has 5 more times of developing a tendinopathy. But we also know that changes cannot be considered by themselves specifically as a predictor of tendinopathy. So we know also that pain and pathological changes are not directly related 100%, that tendon can have a rupture without pain. In most of cases, it's like this. This happens if there is not enough intact fibers to support a certain type of load. And the most important factor is to determine how much tendon fibers are intact to really know what is happening to that tendon. So that makes me think about the question, which is the real role of imaging tests in the diagnosis and control or assessment in the tendon pathology? Ultrasound, MRI, both. None of this is useful. Let's talk about a little bit, especially in ultrasound. So what can ultrasound show us? Let's make first a little review of the recent literature. In this article from 2016, it is a meta-analysis of 17 randomized controlled trials in athletes that says, that I said before, that asymptomatic tendons with structural changes in ultrasound has 5 times more risk of developing tendinopathy. Despite these, structural changes, as you know, cannot be considered by themselves a predictor of tendinopathy. So we need to take into account that these sonographic changes plus predisposing factors such as workload, alteration of access, inadequate materials can help in prediction of these tendinopathies, at least to take into account all these things. This is another study that also is a meta-analysis that says that if we look at these 4 ultrasound patterns or ultrasound changes, such as echogenicity, thickness, vascularization, and fibrillar pattern, in those studies where 3 of these 4 parameters were studied, where the association between structural changes and tendinopathy was really, really, really high. So for now, we can see that obviously there is no 100% correlation between clinical changes, ultrasound changes, and clinical aspects, but there is also, we need to know that there is a relation. In this another study, we have trying to classification of the ultrasound changes in thickness, echogenicity, vascularity, according to the continuum model of tendon pathology. This is an ultrasound-based criteria staging of tendinopathy. So this is the article. This is really, really recent. This one, 2020. We need to know that the criteria is reliable in staging Achilles tendinopathy and aligns with accepted clinical terminology used to describe this tendinopathy. So we know ultrasound, at least in my humble opinion, is the best imaging method for assessment tendon, but what should we look at? We need to know exactly what we want to find. we're looking for some information that it could be useful for the treatment or for the follow-up of this. And we can say that that this rotation can make some implication in terms of pathology, and we also need to know that the right foot has a rotation in a clockwise sense and the left foot anti-clockwise direction. So this is important. Let's look at the video, and we see here, for example, in the left one, look how the rotation is an anti-clockwise direction, and in this one, look that how it is in the clockwise direction. So this is interesting to see in ultrasound. Yeah, you know, it's a freaky thing. It's really cool to show it, but it can also give us information about, for example, partial tears in the Achilles tendon. We can know exactly from which part of the calf muscles are they coming. So it could be of interest to know that that part and to treat some specifically some specific structures in the calf muscles also. We need to know also how it is the HOFA and Cajer fat pad. We know that there is a great vascularization in the fat pads, and this contributes in the formation and the presence of neovessels in tendons, because the fat pads are large producers of cytokines, which are directly related in the pathophysiology of the tendinopathy. So we can assess, for example, in a normal tendon, as we can see here, in correlation with the contralateral tendon, that there is a captation in the power Doppler just in the fat pad, and you can see a fibrillar and correct pattern of the Achilles tendon. So the state of the HOFA and Cajer fat pad is also important to see if there could be a tendinopathy in a while. We can see here again in this video that the neovascularization is located only in the fat pad with a normal Achilles tendon and a fibrillar pattern Achilles tendon without any pain. The third point is the paratendon and the sheath state. There is an increase of thickness in the paratendon, or a poor definition of this paratendon, and we need to also differentiate that from what is called the peritendinitis or tendinosynovitis, which is an inflammation of this paratendon. This increase of thickness, it means that there is also a tendinopathy or something that can lead to a tendinopathy. Look here, for example, in this Achilles tendon, look to this increase in the paratendon thickness. You can also see degenerative changes inside the Achilles tendon in this transversal ultrasound scan. And also here in the photo, you can see that the neovessels entering from below. Again, another important thing is the vascularization. We're looking also always to the vascularization in the power Doppler. There is a positive tendency of have neovascularization in symptomatic tendons. We need to understand that the vascularization normally shows a chronicity of this tendinopathy, because we have enough time before to develop these neovessels that starts growing very, very in early stages of the tendinopathy. We can see here an increase of thickness, as we can see, and this neovascularization. Note that normally this vascularization has a direction, and this direction normally, as we can see, comes from the fat pad below the tendon. So it is important that the role of the fat pad again. And one of the trickiest things that we need to understand when we assess tendons in ultrasound is the intrasubstantial partial ruptures, these longitudinal splits that we can sometimes see, these changes in the fibrillar pattern. So it is very tricky to understand which is a degeneration area or sometimes a partial rupture. I can tell you that partial rupture has more anechoic appearance due to the presence of fluid. So degenerative areas are more hypoechoic, and partial ruptures normally are more anechoic directly. So it is also important to make a dynamic study for that kind of images. Look here, increase of thickness. Look this area here, and look that there is an anechoic area inside the tendon, very, very small, very mild. Also here, the same case. This is the static image. This is the video. So it is interesting to note, for example, so in that case, let's see where it is. We can see here, look, this anechoic area, round anechoic area, which corresponds, and look also, I will put again the video because I think it's really interesting to understand two things in this video. There is an anechoic region, which is a partial rupture here. And also note that as we're moving distal, this area is rounding in that direction. So this goes according to the anatomical variability and the rotation of the Achilles tendon we said before. Again, very important, the dynamic maneuvers, dynamic and the static and dynamic and tension relaxation assessment. This is the, I think this is the strongest point of the ultrasound, because sometimes when we see an image like this, a static image, we can say that there is something strange here, but when we make a contraction, it appears that split, longitudinal split inside the patellar tendon. So this is just in relaxation and with contraction of the quadriceps muscle. So it appears that kind of rupture that we cannot see if there is in relaxation. Again, in that case, we make a contraction and it appears all changes here. So it's important to move and to make tension, make relaxation, structure that. And in transversal axis, when we make a contraction of the quadriceps, we can see this hole inside this patellar tendon. Thickness and echogenicity. We know exactly how to look at that. It's one of the most common findings that we can see when there is a tendinopathy or when there is tendon pain. And we know that decrease in echogenicity represents a decrease in the attenuating properties of tendon ultrasound as a result of disruption of collagen bundles, as Warren said in 2003. So we can see that there is a part of the tendon that is completely normal sometimes, but there is a part that there is not. So we can define exactly where there is. We can also see the thickness we can see here, and we can define that the most superficial part of this structure of this Achilles tendon, it has echogenic different properties than the most deepest part of this, the same Achilles tendon. So this is again information that we need to know, or we need to understand, or we need to we need to try to understand what does mean. Again, we see here a very increase of thickness in this middle third of the Achilles tendon. And in this Achilles tendon, we can see a thickened paratendon, as we can see, and a lot of degenerative areas that we can see here in this transversal ultrasound scan. Also, we can define exactly where are the degenerative areas inside the tendon, or where is the pathology inside the tendon. We can measure it, and we can say if it affects a high percentage of these cross-sectional area of the tendon. So for this case, we need to assess this in short axis. We can have a measure of the whole width of the tendon, and we can say that this is the area affected. So we use a reference point that can be the patella or the calcaneus, and we can say exactly which part of the tendon is affected. So as you can see, ultrasound allows us to locate where the pathology is or where the area of degeneration is. Again, we can see here, this is the whole tendon width, and this is the affected area in this case. Also, in this another case, we can say that there is only an affection of the most medial part of the tendon. So it's also important to know that. And finally, the calcifications. So we need to understand what does a calcification mean. It's not the same a calcification in the body of the Achilles tendon as we can see here, and it's normally related of some systemical disease in some cases. Then, for example, this case of calcifications as a Haglund deformity, or this is more an inflammatory process than a tendinopathy process. So we need to understand what does any calcification mean, and if there has a role in the tendinopathy or if it is part of another problem. And ultrasound can also help us with that. So again, here, small typical calcification in the most distal part of the patellar bone, in the most proximal region and deepest region of the patellar tendon. And this is very different. This is a big calcification in the most superficial part of the patellar tendon. So the calcifications are also different in all the tendons in this kind of pathology. So just to take home in tendon ultrasound, for me, ultrasound is the best imaging method per tendon for the tendons. Imaging does not represent the entire clinical picture. We know that, but we can assess structural changes. I think that imaging has been avoided during a lot of time in what is tendon pathology, especially in tendinopathy, and I think that it's just one more source of information. We need to take into account what image can show us, and we need to put in the context of the clinical picture of the function of the tendon. We need to understand the whole picture, but we cannot neglect the imaging in the tendon pathology, because it is a good source of information for us. Although that we know that they are not directly related, all the structural changes and the clinical factors. As I said, ultrasound changes are not negligible. They should be taken into account as one more risk factor or one more source of information. Very important for me. This is the key point of this speech. For the differential diagnosis, we will speak in the MRI in another speech. But for the differential diagnosis, for me, the MRI is the best imaging method. And the future could be the ability to distinguish by image, especially in ultrasound, if the tendon is in an adaptation process or in a degeneration process. I think that these structural changes can be both things. Can be part of an adaptation process of the tendon to a new workload, for example, or can be a part of a degeneration process because this new workload is not well tolerated by the athlete or by the patient, and it will be very important to see if by imaging if that tendon is going to an adaptation process or to a degeneration process. And I think this is all about the ultrasound in tendon. So thank you very much for your attention, and I'm here if you need any questions or any acceleration on that speech. Thank you very much.
Okay, next up from FC Barcelona.